The next chapter we're going to discuss is lifespan development. After you complete this chapter and related coursework, you will have a fundamental understanding of the physiologic and psychosocial differences of each phase of human development. You will be able to discuss adaptations and strategies that you may need to apply to better assess and manage patients. Under the National EMS Education Standard Competencies for Preparatory, again, this applies fundamental knowledge of the EMS system, safety well-being of the EMT, medical, legal, and ethical issues to the provision of emergency care. For lifespan development specifically, you will be able to apply fundamental knowledge of lifespan development to patient assessment and management. Human beings evolve, not just as a species, but as people over their lifespan. You must be aware of the physical changes a person undergoes at various stages in life, and this may alter your approach to patient care. We'll start with infants. An infant is age 1 month to 1 year, and they develop at a startling rate. Neonates, birth to 1 month, will cover specifically in Chapter 31, Obstetrics and Neonatal Care. Some of the physical changes that we see with infants are their vital signs. We have to understand that the younger the person, the faster the heart rate and respirations. At birth, a heart rate of 90 to 180 and a respiratory rate of 30 to 60 are considered normal. Shortly after birth, the pulse often drops to 100 to 160 and the respiratory rate drops between 25 and 50. By 1 year, the rate slows to 20 to 30 breaths a minute for respiration. Blood pressure directly corresponds to a patient's weight, so it typically increases with age. The average systolic pressure is between 50 and 70 for a neonate and 70 to 95 by age 1. A neonate usually weighs 6 to 8 pounds, or 3 to 3.5 kilograms at birth. They grow about an average of 30 grams a day, and the head accounts for 25% of its body weight. By the end of the first year, the weight will actually triple. At 4 to 6 months, it will probably have doubled. The cardiovascular system, at birth, a neonate makes the transition from fetal to independent circulation. The pulmonary system, in infants younger than 6 months, are prone to nasal congestion. Their rib cage is less rigid, and they can more easily occlude their airway. The reason for this is their proportionally large size of the tongue and a proportionally shorter, narrower airway. If we're utilizing bag mask ventilation, we have to remember that an infant's lungs are fragile. If we ventilate too forcefully, it can result in trauma from pressure or barotrauma. Respiratory problems are quickly to become life-threatening. Infants who are struggling to breathe can quickly tire, become overheated, and even dehydrated. An infant's nervous system's evolution continues after birth. Neonates are born with certain reflexes. The Moro or startle reflex happens when a neonate is caught off guard. The neonate opens the arms wide, spreads the fingers, and seems to grab at things. The palmar grasp occurs when an object is placed into their palm. The rooting reflex takes place when something touches the neonate's cheek. The neonate will instinctively turn his or her head toward the touch. The sucking reflex occurs when a neonate's lips are stroked. This and the rooting reflex are often tested when feeding. A neonate's fontanelles allow the head to be molded through the birth canal. The 3 or 4 bones of the skull eventually bind together and form suture joints. Generally, the posterior fontanelle will fuse at about 3 months, and the anterior fontanelle, which is on the top of the head, usually fuses between 9 and 18 months of age. Their immune system maintains some of the mother's immunities, and infants can also receive antibodies via breastfeeding, which further bolsters their immune system. Here you see examples of the fontanelles. This is the anterior fontanelle, and it allows the skull plates to overlap during the travel through the birth canal. The posterior fontanelle is smaller, closes more quickly. Psychosocial changes begin at birth for neonates. They evolve as the infant interacts with and reacts to the environment. Crying is the main method of communicating distress. The key to having a happy, healthy infant is spending time with the child. Bonding, or the formation of a close personal relationship, is based on a secure attachment. A secure attachment occurs when an infant understands that parents or caregivers will be responsive to their needs, and a child can reach out and explore knowing that the parents will provide a safety net for them. Another type of attachment, anxious avoidant attachment, is found in infants who are repeatedly rejected. Children show little emotional response to their parents or caregivers and treat them as they would strangers. Separation anxiety is common in older infants, and the normal reaction peaks between 10 and 18 months. It involves clingy behavior and fear of unfamiliar places and people. Trust and mistrust refers to the stage of development from birth to about 18 months, which involves an infant's needs being met by his or her parents and caregivers. When caregivers and parents provide an organized, routine environment, the infant gains trust in those individuals. If the environment is not perceived as secure by the infant, a sense of mistrust will develop. Toddlers and preschoolers. A toddler is considered age 1 to 3. Some of the changes that we see physically: pulse rate 90 to 150 beats a minute, respiratory rate is 20 to 30 breaths a minute, systolic blood pressure is 80 to 100 millimeters of mercury, and their temperature is generally 96.8 to 99.6. A toddler's lungs continue to develop more terminal bronchioles and alveoli. For preschoolers, age 3 to 6 years, the pulse rate is 80 to 140 beats a minute, the respiratory rate is 20 to 25 breaths a minute, the systolic blood pressure is 80 to 100 millimeters of mercury, and their weight gain should level off. Although toddlers and preschoolers have more lung tissue, they do not have well-developed lung musculature. This anomaly prevents them from sustaining deep or rapid respirations for an extended period of time. The loss of passive immunity is possibly the most obvious development at this stage of human life. Colds often develop that may manifest as GI distress or upper respiratory infection. Neuromuscular growth also makes considerable progress at this age. Toddlers and preschoolers spend a great deal of time finding out exactly how to use their expansive nervous system and the muscles it controls by walking, running, jumping, and playing catch. At this point, preschoolers will have a brain that weighs 90% of the final adult weight. Physiologically, toddlers have the neuromuscular control capable for bladder control by 12 to 15 months. However, the child may not be psychologically ready until 18 to 30 months of age, and the average age for completion of toilet training is about 28 months. Teething also occurs in this time frame. Psychosocial changes that occur. This period of development is often exciting for parents. Toddlers or preschoolers learn to speak and express themselves. By 36 months of age, basic language is mastered. Interaction and playing games with other children begin, and by 18 to 24 months, cause and effect begin to become understood. Children learn to recognize sexual differences by observing their role models. School-age children, age 6 to 12 years. From 6 to 12 years, a school-age child's vital signs and body gradually approach those observed in adulthood. The pulse rate is approximately 70 to 120, the respiratory rate is 15 to 20, and blood pressure is 80 to 110 millimeters of mercury. Obvious physical traits and body function changes become apparent. Growth of 4 pounds and 2.5 inches in every year happen. Permanent teeth start to come in, and brain activity increases in both hemispheres. Psychosocial changes. Children learn various types of reasoning. The first is pre-conventional reasoning. They act almost purely to avoid punishment and get what they want. Conventional reasoning, children look for approval from their peers in society. Post-conventional reasoning, children make decisions guided by their conscience, and self-concept and self-esteem is developed. Self-concept is our self-perception, and self-esteem is how we feel about ourselves and how we fit in with our peers. Adolescents or teenagers. General age here is 12 to 18, and vital signs are now beginning to level off within the adult ranges. The heart rate is generally 60 to 100, and the respiratory rate is 12 to 20. Systolic blood pressure is between 90 and 110. Adolescents experience a 2 to 3 year growth spurt and increase in muscle bone growth as their body changes. Girls will finish by 16 and boys by 18. When this growth spurt finishes, boys are generally taller and stronger than girls. Their reproductive system will begin to mature, and secondary sexual development takes place. The external sex organs enlarge, pubic hair and axillary hair begin to appear. Voices start to change. In females, breasts and thighs increase in size as adipose fat tissue is deposited. Menstruation begins, and by the middle of adolescence, boys are able to produce sufficient sperm and girls are able to develop eggs. Acne can also occur due to hormonal changes. Psychosocially, adolescents and their families often deal with conflict as adolescents try to gain control of their lives from their parents. Privacy becomes an issue. Self-consciousness increases. Adolescents may struggle to create their own identity, and they often want to be treated like adults, yet cared for like younger children. Antisocial behavior and peer pressure tend to peak at age 14 to 16. Smoking, illicit drug use, and unprotected sex are problems that may arise, and eating disorders can arise in adolescence from an attempt to gain self-control through what they eat. Adolescents may show a greater interest in sexual relations. A code of personal ethics develops based partly on parents' ethics and values and partly on the influence of their environment. Adolescents are at a higher risk than other populations for suicide and depression. Early adults. These are individuals in age range from 19 to 40 years. Their vital signs don't vary greatly from those seen through adulthood. The heart rate will average around 70 beats a minute and range between 60 to 100. The respiratory rate will stay in the range of 12 to 20 breaths a minute. Systolic blood pressure will vary between 90 and 140 millimeters of mercury. From the age of 19 to shortly after 25, the body should be functioning at its optimal level. Lifelong habits are solidified and the body is working at peak efficiency, but as early adulthood continues, subtle erosion begins. Discs in the spine begin to settle and height sometimes shrinks. Fatty tissue and weight increase and muscle strength decreases and reflexes slow. Psychosocially, life centers on work, family, and stress. During this period, adults strive to create a place for themselves in the world, and many do everything they can to settle down. Along with this comes love and childbirth. And despite all of this stress and change, this is one of the more stable periods of life. Middle adults are age 41 to 60. Physically, their vital signs remain the same. Heart rate averages at 70, ranges between 60 and 100. Respiratory rate still 12 to 20. Blood pressure remains between 90 and 140 millimeters of mercury systolic. Middle adults are vulnerable to vision and hearing loss. Cardiovascular health starts becoming an issue. The incidence of cancer will increase. Menopause takes place in women in the late 40s or early 50s. Diabetes, hypertension, and weight problems are common. Exercise and a healthy diet can diminish some of these aging effects. Psychosocially, the focus is on achievement of their life goals. Middle adults must readjust their lifestyle as their children leave home. Finances become a worrisome issue. Generally, people of this age have the physical, emotional, and spiritual reserves to handle life's issues. Middle adults can find themselves caring for children leaving for college and caring for their aging parents as well. Late adults, age 61 and up, also known as 65, is our geriatric population. Life expectancy is constantly changing. Physically, in the early 1900s, life expectancy was 47 years. It is now approximately 78 years, with maximum life expectancy estimated at 120 years. The age to which a person will live is based on many factors, including the year of their birth and the country in which they live. Their vital signs depends on their overall health, medical conditions, and medications that they take. Older adults are often able to overcome numerous medical problems. They may need multiple medications to do so. Cardiovascularly, their function declines with age largely due to atherosclerosis. Cholesterol and calcium build up inside the walls of blood vessels, forming plaque. The accumulation of plaque eventually leads to partial or complete blockage of blood flow. More than 60% of people older than 65 have atherosclerotic heart disease. Their heart rate and cardiac output decrease. Cardiac output no longer meets the body's demands. The vascular system becomes stiff, and diastolic blood pressure will increase with age. The heart must work harder to move the blood effectively, and the ability to produce replacement blood cells declines, as does blood volume. The respiratory system, airway size increases and the surface area of alveoli decrease. The natural elasticity of the lungs also decreases. Intercostal muscles are used more to breathe, and breathing becomes more labor-intensive. The changes in the respiratory system are often gradual and go unnoticed until a severe life-threatening condition occurs. And within the mouth and nose, there is a gradual loss of the mechanisms that protect the upper airway. This leads to a decreased ability to clear secretions, as well as decreased cough and gag reflexes. Aspiration and obstruction become more likely in this age group. As the smooth muscles of the lower airway weaken with age, strong inhalation can make the walls of the airway collapse inward and cause inspiratory wheezing. The cells of the immune system are less functional, and by age 75, vital capacity may amount to only 50% of the vital capacity of a young adult. Factors include loss of respiratory muscle mass, increased stiffness of the thoracic cage, decreased surface area available for the exchange of air, and residual volume will increase with age. A lifetime of breathing, especially breathing air with high levels of pollution, causes the accumulation of pollutants in the lungs. The endocrine system, insulin production drops off and metabolism decreases. As we are in this age group, people tend to slow down their physical activity. They tend not to decrease their food intake, however. The pancreas may not be able to produce enough insulin for the person's body size, which can lead to diabetes. The reproductive system changes to some extent. Men are able to produce sperm long into their 80s, but the rigidity of the penis tends to decrease over time. And women have a decrease in the size of their uterus and vagina. Hormone production for both sexes gradually decreases as they age, and sexual desire may diminish with age, but certainly does not cease. The digestive system changes, and gastric and intestinal function may inhibit nutritional intake and utilization in older adults. Your taste sensations decrease. Saliva secretion decreases. The ability of the intestines to contract and move food diminishes. Gastric acid secretion diminishes. Gallstones become increasingly common. The anal sphincter changes, and that can produce fecal incontinence. The renal system filtration function declines by 50% from age 20 to 90. Kidney mass decreases 20% over this same time span. This is due in part to the decreased effectiveness of the blood vessels that supply blood to the nephrons. Nephrons are sophisticated capillaries that perform filtering within the kidney. There is decreased ability to clear waste from the body, and there is decreased ability to conserve fluids when needed. The nervous system. In the central nervous system, the brain weight may shrink 10 to 20% by age 80. Motor and sensory neural networks become slower. Neurons are lost, but this does not mean there is a loss of knowledge or skill. Sleep patterns will change. The brain, which is surrounded by the meninges, takes up almost all the space in the skull. Unfortunately, age-related shrinkage creates a void between the brain and the outermost layer of the meninges, which provides room for the brain to move when stressed. Peripheral nerve sensation is diminished. Increased reaction times cause longer delays between stimulation and motion. The resulting slowdown in reflexes and decreased kinesthetic sense may contribute to the incidence of falls and trauma. You can see here the difference in the brain. Sensory. Most late adults can see and hear well. They may need glasses or hearing aids, and it is wrong to assume that they're blind or deaf. Visual distortions are common, and hearing loss is 4 times more common than vision loss. Psychosocially, until about 5 years before you die, most people retain high brain function. In the 5 years preceding death, however, mental function is presumed to decline, a theory referred to as the terminal drop hypothesis. As the elderly population continues to grow, we have the responsibility to accommodate their needs during the last 20 to 40 years of life. Statistics show that 95% of the elderly live at home, and the increasing number of elderly in the United States as a result of the baby boom of the 40s and 50s has produced a need for additional assisted living facilities. Financial limits may restrict access to health care or medications. Today, more than 50% of all single women in the United States who are 60 years of age or older are living at or below the poverty level. Elderly face the issue of their own mortality. This is one of the important things that we deal with, and isolation and depression can become challenges for them. In summary, whereas each developmental stage is marked by different physical and psychosocial changes and characteristics, infants 1 month to 1 year develop at a startling rate. The vital signs of toddlers Ages 1 to 3 years and preschoolers aged 3 to 6 years differ somewhat from those of an infant. During this stage, children learn to speak and express themselves. From age 6 to 12 years, the school-age child's vital signs and body gradually approach those observed in adulthood. During this stage, children develop self-esteem. From ages 6 to 12 years, self-esteem is developed and their vital signs and body change generally to approach adulthood. Vital signs of adolescence, age 12 to 18, begin to level off within the adult ranges. Adolescents focus on creating their self-image. Early adults are age 19 to 40, and they focus on work and family. Middle adults are 41 to 60, and they focus on achieving their life goals. Late adults are age 61 and older, and late adults focus on their own mortality and the mortality of friends and loved ones. Vital signs do not vary greatly throughout adulthood. Thanks for listening to this lecture, and tonight in class we'll discuss some of these things. Please bring any questions you may have.